So today we will discuss about safe sleep practices and little bit about the sleep routine for the babies because that much time we have. Sleep is very vast topic, and we arranged webinar, sleep webinar, proper sleep webinar. It takes at least 4 hours with the 2 sessions. So that was vast is this topic, safe sleep. So today we will discuss about this briefly because your sleep depends on baby's sleep. So hi, I'm Dr. Sumitra. I'm MD pediatrician, founder of Babynama, certified baby sleep expert, and also certified lactation expert. If you have any issue with the breastfeeding or baby sleep, you can reach out to me. So now what is SIDS? It's a scary term, sudden infant death syndrome. It's an umbrella term. It is defined as unexplained death of a baby under 1 year of old. You can't explain what really happened with the baby. That's why it is sudden infant death syndrome or unexplained death syndrome. All right. Often occurs during sleep and leading cause of death under infant under 12 months of age. So few years back, in America, there was an awareness campaign was running, which was called "Sleep on the Back." And after that, it has been seen that the drastic decrease in the sudden incidence of sudden infant death syndrome. So it's very important to know for the parents that what are the safe sleeping guidelines so that they can follow and they can prevent this SIDS. Personally, I have seen so many kids who are coming, especially in the winter time. They come to us in the emergency. They come already they expired, and the parents come with the baby in the emergency, and we could not do anything apart from creating this awareness, apart from spreading this awareness. So it's very important for the parents to know the safe sleeping guidelines. So 90% of SIDS that occur before 6 months of age, and most happen during nighttime sleep. Prevention begin with the informed caregiver. As I said, that if you know what to do, then of course you can prevent this SIDS. So key risk factors, what are the key risk factor for SIDS is the sleeping on the stomach or sleeping on the back, like prawn position. Sleeping on the stomach or sleeping on the side lying position initial 6 months of age. Soft bedding or loose items on the crib, which can choke the baby or which can suffocate the baby. Overheating, of course, the room should be comfortable, but if you are using heater in the winter, then overheating is the reason for might be the reason for the sudden infant death syndrome. Exposure to smoke, passive smoke. Actually, if the parents are smoking, then it's the higher chances of SIDS will be there. Premature birth or low birth weight baby, and bed sharing, of course. Bed sharing is debatable actually, but yes, for first 6 months, bed sharing like in between two parents is not advisable. You can make a separate kind of newborn corner, which we will discuss in the next few slides. All right. So these are the risk factor for the SIDS. Now, what is the ABCs of safe sleep? First, A is alone. Baby should always be on their own sleep surface. Bed sharing is a risk factor for sudden unexplained infant death syndrome and other sleep related deaths. So some people says that, okay, it is a Western culture that baby should be sleep in the crib. You can share the room because room sharing is recommended in for 6 months for the emotional attachment and for the safe breastfeeding and for to establish breastfeeding. But when it comes to bed sharing, because mother is tired, father is tired due to the constant taking care of the baby, they can be like they are exhausted and they are sleep deprived. So there are higher chances that they can go into deep sleep and they can kind of suffocate the baby. That's why bed sharing between two parents is not advisable. If you want to share bed, then you can make a separate mattress on the same bed, and then you can say share in the side, one side of the bed, so that you can do. So in that case, the baby is in the safer zone. All right. Second is the B is the sleeping on the back. The baby should always sleep on the back. That is the safest position for the baby. C is the crib. The crib should be empty. There should not be any pillows or soft toys or loose combles, because that might cause the suffocation. So if you are sharing the bed, then also you have to keep your pillow, or you should not use. You can use only one pillow which under you, and there is no pillow, no loose comble on the side of the baby's bedding. All right. So these are the ABC for the safe sleeping guideline. Now, what are the checklist? Firm mattress. It should be fit in the crib. No toys, no pillow, no loose blanket or crib bumpers. Use a sleeping sack instead of loose blanket. You can use sleeping sack, or you can, for first 3 months, you can saddle the baby, and avoid sleep positioners. Now, as I said, that there is a debate that should we share room, should we share bed? Yes, room sharing is recommended for first 6 months, because to establish the breastfeeding and to establish the bonding between parent and the child, it is recommended. But the bed sharing, as I said, you can share the bed with precautions. Otherwise, you can keep the crib in the side of the bed only, and then whenever you want to feed, you just take out the baby and feed the baby, and then you can just put the baby in the crib, because that is just beside your bed. There will be no hampering in the emotional bonding or physical bonding that way. So room sharing, as I said, recommended. Make night feeding and monitor very easy if you're room sharing for 6 months, and reduce risk of SIDS by up to 50% by room sharing, because you are aware of the baby. If anything happens to baby, you will be awake and you can check constantly on the baby. Looking at the baby monitor and looking at the baby at the same time are two different things. So if your baby is in your room, then you can check you can check very frequently to the baby, and that will reduce the risk of SIDS up to 50%. Now, bed sharing, as we discussed already. So the key message here is the room sharing is safe and encouraged. Bed sharing is not. If you want to share bed, then make a separate newborn corner for the baby. All right. Now, proper sleep position, always back. Never place baby on the side or tummy, because in the side position also baby might tilt on one side or roll over on the one side, and the baby might suffocate himself or herself. Provide tummy time only while baby is awake. Apart from that, temperature should be comfortable, 68 to 72 degree Fahrenheit. Dress baby in the one layer more than you, and it should be comfortable. No, don't over dress baby, because that might cause overheating. Don't cover baby's head indoor. That also sometimes the cap might come on the face and the nose, and that might cause breathing difficulty in the baby. And choose fabric wisely. Choose only cotton or muslin cloth for the baby. Now, bedtime routine. Bedtime routine is very, very important since beginning, since birth, because baby's brain works on the predictability. The baby's brain will know that, okay, this will happen at 7 o'clock with me every day. Then the baby will be happy and the baby will sleep better. So a predictable routine helps baby sleep better. You can include, according to your convenience, according to the environment, you can choose 120 minutes to 30 minutes simple bedtime routine, like you feed the baby, give the massage, bathe the baby, put the clothes and diaper on, do some routine activities maybe for 5-10 minutes, or show the book and then put the baby sleep. These are the simple steps you can make you can incorporate in the bedtime routine, and this should be in the same order every day at the same time. That will help baby sleep better. All right. Now, one more important thing is the following the age-wise wake window, which is very, very important. I have seen, I have taken so many sleep consultations, and in which the major thing which parents are following is the wake window. जब बेबी सोएगा तभी सुला देंगे, 3 घंटे हो गए, 4 घंटे से जग रहा है बच्चा, baby is awake for 4 hours. The 1 month baby is awake for 4 hours, which is not correct at all. Like the 1 month baby should sleep every 1 to 1.25 hours. That is the wake window the baby should follow. And the baby is awake for 4 hours. What will happen into his body? The body will accumulate the cortisol, which is stress hormone, and the baby will not sleep properly. So the wake window is very important to follow, both in the daytime and of course nighttime sleep. So 0 to 3 months, the baby should sleep at least 14 to 17 hours. Sometimes the initial for 1 month baby sleep for 18 to 22 hours. That also completely fine. 4 to 11 months, 12 to 15 hours per day, and 1 to 2 years, 11 to 14 hours per day. So today I took one sleep consultation, the baby was sleeping around 10 to 11 hours, maximum 12 hours. And the mother said the baby is cranky all day. What should she do? Then the simple solution that we need to fix the sleep. We need to increase the sleeping hours because the baby was sleeping less. Signs of what are the signs of like hunger cues? You have to see the sleeping cues: rubbing the eyes, turning head away, slower the body movement, sluggish body movement, sluggish movement of the baby is not interested in the play, the baby is not playing, so, and the fuzziness and yawning, and eventually crying is the last stage. And crying is the sign of overtiredness, that they are overtired. And once the baby is overtired, it is very difficult for baby to put to sleep. So it's important for the parents to notice the sleeping cues and put the baby, leave everything aside, and put baby to the sleep. When to consult a sleep consultant? If your baby struggle to breathe or snore heavily, if the baby's sleeping pattern is changing, if the baby is not sleeping properly, the baby seems to having difficulty or falling sleeping back, or you want to taper some association like pacifier, nursing to feed, and you want to understand what is the physiology for the baby sleep, then you should consult to the a sleep consultant. So always place baby on the back for the safe sleep, and to prevent SIDS, keep the sleep space clear and firm. Avoid bed sharing and soft bedding. Establish a calming, consistent bedtime routine is very, very important. Following wake window is very, very important. And stay alert to your baby's cues and needs. All right. Thank you so much. Now we are open for the questions. And I have to go early, so I'll take few questions only. All right. Divya, over to you.
Yes, Garima ma'am, you can ask.
Hi, ma'am. Thank you for the session. It was very helpful. Ma'am, sometimes my baby sleeps for only 5-10 minutes and then he wakes up smiling. So is that, matlab, it's a power nap or I mean,
How
is
old
it
is your baby? How old is your baby?
6.5 months?
6.5 months. So see, if the baby is waking up after 5 minutes, 10 minutes, of course, that is the power nap, or you can say during changing sleep cycle, they kind of don't can't bridge the one nap to another nap. So what you need to do, you need to bridge that nap. So you take the baby, or you can let them for some time. Don't engage with them. Just let even they are playing, let them play for some time, and they might sleep back, because they are in the transition of the one sleep cycle to another sleep cycle. If the baby is waking up, then you can just take the baby and do some rocking and do some patting and then put back the baby. Because if the baby is waking up so frequently after 5-10 minutes, then the baby will not complete the proper sleep, and then baby might be cranky whole day.
Yes, ma'am, exactly that happens sometimes. And also, ma'am, one more thing is that we have seen that in the evening time we take the baby down in the pram, the stroller, and in the sleep position of the stroller, and he's lying there. And sometimes while walking around, he sleeps because of the movement.
Hmm.
So then, but I've heard that do not allow the baby to sleep in the pram, but he sleeps well that time.
If you're keeping
Um,
eye on the baby, then
yeah.
it's fine. You have to keep
Okay.
an eye on breathing actually. And the neck should be like properly placed. The neck should not be flexed. That is the main reason we say that don't allow baby sleep in the pram. If the baby is in the supine position and the neck is well placed and there is no chances of that the neck will be flexed and the baby might have issue in the breathing, then it's fine. It's completely fine.
Okay. Thank you, ma'am.
Okay.
Hi, ma'am. Uh, my kid is almost like he'll be 1 year in about 2 weeks.
Mhm.
Still now, he wakes up every 2 hours, 3 hours in the night for feeds, even if his morning times solids is nicely he takes up,
Hmm.
and
You
it's
need to
becoming a
taper
problem.
comfort feeding. Your problem is the comfort feeding. So, understand like this that whenever we eat food, let's say we have breakfast around 9 o'clock, our brain will indicate our body, and our brain will indicate our stomach that you are hungry, right?
Mm-hmm.
Even
Mm-hmm.
like our brain, and same is happening with the baby. If you give comfort feeding every 2 hourly, then the baby's brain will wake them every 2 hourly, and then you have to give feed. There is no chance, there is no there is no you cannot stop them waking up. Now what you need to do, you need to stop comfort feeding or give
How can I overcome?
you have to stop feeding, because the
Okay.
11 months baby doesn't need every 2 hourly feed.
Yeah, yeah. Uh,
Okay. So you can give feed around say 5-6 hours mein. You don't need to give
okay.
every 2 hourly feed. So
I
you
mean,
need to give
if he
feed
cries, I can
without.
let him cry.
No, I'm not saying I'm not
No,
in
no,
favor
no.
of cried it out method. No, not at all.
Okay, okay,
So you
okay,
need
okay.
to pick the baby and you need to do little bit rocking, and then you can put baby sleep for some time. And once the baby's brain is adapted to that, okay, I'm not getting any feed, then the baby will not wake up.
Okay, probably I can take my partner support, like me not
Yes, yes,
sleeping beside
right.
him,
Yes, right.
because he keeps on searching for
Yes. So what you need
milk.
to do in such case, what I tell parents that you can put the baby sleep and you can sleep in another room and your partner can take care for 1 or 2 weeks. Then the baby will not ask for feed and will not wake up so frequently.
Okay,
Good
okay,
afternoon,
okay,
ma'am.
okay, ma'am. Thank you.
Good afternoon, ma'am.
Yes.
My baby is 4 months, 10 days old, and she sleeps during night for 5 to 6 hours, and I usually don't disturb. I also sleep during that period.
Hmm.
So the gap occurs, and she takes feed after 6 hours generally.
That's fine if the weight gain is fine.
Weight gain is fine, but
And it's
like
completely fine. Don't worry about it.
okay, okay.
Hmm.
So I let her sleep now whenever
Yes,
she sleeps.
yes,
Then
yes. If the weight gain is fine, if the baby, even the baby is sleeping for 6-7 hours in the night, it's completely fine. The main night feeds are for the weight gain. If the baby is not
weight
gaining
gain is,
weight,
ma'am.
we
Initially,
advise
her weight.
parents to feed frequently in the night, because in the night the energy consumed by body is less and then the intake is more, then that will help in the weight gain. So if the weight gain is fine, you can let baby sleep even for 5-6 hours, 7 hours also.
Initially, her weight gain was less. She was born 3.7 kg. Now, initially, it was less. Now, she is 5.7, 5.8, close to kg. So, is it good?
3.7 से 5.8 हुआ है अभी.
4 months में.
4 months. So it's not doubled yet actually.
हाँ.
So weight gain is not that good. So what usually happens if the baby is more than 3 kg, they doubled their weight around between 5 to 6 months of age. So it should be at least 6.5, around 6.7, 6.8 by the
She's
end of
4
6 months.
months. She's 4 months.
I'm just telling you that for at the end of 6 months, she should be around 6.8 kg, 6.8, 6.9 kg. So according to that, you can decide that how much to give feed in the night.
Acha.
ठीक है?
So, okay.
Yeah.
So should I wake up her according to weight statistics?
So now she's 4.5 months, na?
Huh.
You have 1.5 months and she has to gain 1 kg. I think she will gain. Don't worry.
Okay.
You don't need
Thank you so much.
Mm.
That's
Yes, Noreen, you can ask next.
Yeah, thank you, doctor. Can you hear me?
Yes, I can hear you.
Yeah. So, doctor, my baby is 3 months and 2 weeks old. He had been sleeping very well in the night. He used to sleep for 4 to 5 hours straight. But now,
Sorry,
since last,
your voice is not clear, Noreen.
uh, can you just give me a minute? Is it better now? Is it
Little
better
bit
now?
better, but tell me.
Okay, so I was just saying that my baby is 3 months and 2 weeks old. He
Mhm.
used to sleep well for 4 to 5 hours in the night, but since last 4 or 5 days, he is getting up every hour. So I believe this is the sleep regression that's happening. So I don't know
Yes.
what to do. He wants to feed every time he gets up. I don't know how to break it. Is it okay if I feed him? That will become a sleep association. So I'm just like really tired and I don't know what to
Okay.
do there. So
So yes, around 4 months, they have sleep regression. And during that time, even one growth spurt also happens that time. And during growth spurt, they feed vigorously. They feed like I want to feed like every hourly and I want to be on breast. That kind of uh, behavior they show during the growth spurt because they need energy. So maybe she's going through both the phases, sleep regression and growth phase. What you need to do that if you are tired and you're tired of feeding and you don't want to feed like for the like cluster feeding. So what you can do, you can ask help from your partner or whoever is available in the family. They can take the baby and they can rock for some time and they can put the baby sleep and after 2 hours you can feed again. And this is a phase, this will go away.
sure. That's what I wanted to check if it will go away or not.
Yes, it will go up, definitely.
Okay.
Don't worry.
Okay. Thank you.
Yes, Nidhi.
Hello.
Nidhi, you can go next.
Hello, ma'am.
Yes.
Can you hear me?
Yes, I can hear you.
Yeah, my daughter is 24 days old.
Mhm.
Yeah, and she has like she wants to sleep in the lap only. If I put her on her bed, she wakes up.
It's okay, Nidhi, because till now she was with you in your room and she was in comfortable position. Now, this is very big change for the baby. She has to adapt outside environment and she's not familiar to that environment. She's scared. You can see in this way that she is scared. She doesn't know anybody else apart from you. She can just recognize your sound. That's why she wants to sleep more in the lab. She doesn't want to, she wants your contact basically, skin to skin contact. So it's completely fine till 1 year of age. They need more and more physical association. After that, they start adjusting to outside world. So it's fine. You can give contact naps. You can ask your family members that they can put the baby on their chest and they can lie down, not sleep. They can lie down. They have to be awake, but they can lie down, put the baby on the naked chest or tummy, and the baby can sleep on the tummy and chest.
Okay, and sometimes after feeding also she doesn't sleep. She is wide awake after feeding. What to do in that case?
If the wake window is over, then you have to rock the baby and then put the baby sleep. Baby should not be overtired. If the wake window is still there, then you can play with her, talk to her, sing to her, and show some black and white book or toys. So that way you can engage her.
For 24 days old, what should be the wake window?
1 hour.
Okay, ma'am. Thank you so much.
So one more question I can take. iPhone. Hello.
Hello.
I think. Hello.
Ma'am. Dr. Dhaval here.
Yes, Dr. Dhaval, बताइए.
My baby is actually 9 months old.
Mm-hmm.
So before last feed, he sleeps at around 7:30 at night
Okay.
and takes the feed at around 11 o'clock.
Mm-hmm.
Another feed at 2:30, and in the morning 5:30 he wakes up.
Mm-hmm.
So is this normal, or we should decrease the feed frequency?
So I think, Dr. Dhaval, if I am correct, I remember your issue that the baby was having reflex, right? That's why we could not increase the amount.
That meal amount.
Yes, meal amount, and we have to give frequent meals, actually.
Correct.
Correct? Okay,
Yes.
okay, remember that. Okay. So see, 3
Burp
feet.
issue was there, some burps. He actually, whenever he sits for his meal
Yes.
solid, the burp starts and he cries and then he stops eating.
Yes, yes. So at 9 months of age, 3 feeds in the night is perfectly fine. You can give 3 feeds. It's fine.
Okay. And last since 15 days or 1 month, whenever he goes to sleep at around 7:30, so 7:30, in between 7:30 and 11, he frequently wakes up. Earlier, this was not so. So after every 30 minutes, he wakes up and then we have to again make him sleep. Is it due to teething issues? Or?
No, not due to eating issue. This is usually happen between 8 to 12 months because they go through a major motor milestone development, which is sitting, crawling, standing with support. So they don't know how to go back to sleep. So the baby will wake up and then the baby will sit and baby will cry, or the baby will get up and standing up and then the baby will cry because they don't know how to go back to sleep. Once they learn that art, that okay, they are perfect in that, like they are crawling properly, they are walking properly, and then this issue will subside. Even my daughter, who is 8 months 10 days, she gets up every, like till 12 o'clock, she gets up every 30-45 minutes. She will start crying. I have to take her for like 5 minutes and just roam around in the room, and then she will go back to sleep. But I know that problem because they don't know how to go back to sleep between 8 to 12 months. Once they achieve those milestones, then this sleep disturbance will go away.
So should we go back and make him pacify and sleep, or we should leave him alone and let him cope with this?
So you have to see the temperament of the baby. If you know that the baby will not settle down, the baby will cry continuously. Like I know my daughter will not settle down once I don't take her, and then I'll have to like 2 minutes, 2 minutes, just 2 minutes she takes walking and then she will sleep. So you have to see what is the temperament. If they go, they cry for 2 minutes and then they will sleep, then you can let them cry for 2 minutes. It's completely fine. But let's say the baby will not go, even the baby will cry for hour, 15 minutes. Then you have to, of course, take the baby and then you have to put baby sleep. It will take hardly 2 to 5 minutes.
It's not related to some dreams, bad dreams.
No, not at all.
Thank you.
All right. So, Divya, over to you. I have that much time. I have one meeting actually, so I have to go. Rest of the questions, anybody is having any issue with the sleep, they can contact the team. They can schedule a call with me, or they can put basic questions on the group that our doctor will answer. Divya, are you here?
Yes, ma'am. Yes, ma'am.
Yes.
Okay, so due to time shortage, we won't be able to take any more questions. Thank you so much, ma'am, for such an informative session. Your last words of advice before leaving.
Just follow the wake window for the baby according to age group, and just consider that they go through a lots of ages like growth phase, sleep regression, teething, developmental milestone, motor milestone. So the sleep disturbance might happen. You have to be patient. You have to be consistent on the schedule. That's all you need to do for the basic sleep. And if the baby is struggling with the sleep and you are not able to fix, please take help, because sleep is like food for the baby. As we also know, the sleep is very important for our body. You can understand that the growing baby's body really needs very good sleep and deep sleep. So if your baby is struggling, please take help from the expert. And thank you
you,
so much for listening me, and have a nice day.
Thank you so much.
Okay.
You can. Thank you everyone for joining. And if you want to book a consultation with Dr. Sumitra, you can go through our app. You can download it on your phones. It's called Babynama, and you can book a consultation there. Thank you so much for joining. This is Divya ending the session.